somehow or another, Canada can provide universal health care to all their people at half the cost. UK can do it, France can do it, Germany can do it, all of Europe can do it. Gee whiz, somehow or another, we are the only major country on earth that can't do it. Why is that? And I'll tell you why. It's because last year the healthcare industry made $100 billion in profits. Pharmaceutical industry, top 6 companies, $69 billion in profit. And those CEOs are contributing to Pete's campaign and other campaigns up here. Let's clear this up. So maybe it is finally time that we said as a nation, enough is enough. The function of a rational healthcare system is not to make the pharmaceutical industry and the drug companies rich. It is to provide healthcare to all people as a human right, not a privilege.
Mr. Vice President,
no premiums, no co-payments, no deductibles.
Let's go ahead. And then Senator Warren. Mr. Vice President and Senator Warren.
Hey, I'm the only one on this stage that's actually got anything done on health care. Okay? I'm the guy the president turned to and said, go get the votes for Obamacare. And I noticed what everybody's talking about is the plan that I first introduced. That is to go and add to Obamacare, provide a public option, a Medicare-like option. It cost and increase the subsidies. It cost a lot of money. It cost $750 billion over 10 years. But I pay for it by making sure that Mike and other people pay at the same tax rate their secretary pays at. That's how we get it paid, number one. Number two, you know, from the moment we passed that signature legislation, Mike called it a disgrace, number one. Number two, Trump decided to get rid of it. And number three, my friends here came up with another plan. But they don't tell you. When you ask Bernie how much it costs, the last time he said that, I think it was on your show, he said, we'll find out. We'll find out how, or something to that effect. It cost over $35 trillion. Right. Let's get real.
Senator Warren, you get the final word on this. We're going to move to another question. Go ahead, Senator Warren. Go ahead, Senator Warren.
So I actually took a look at the plans that are posted. Mayor Buttigieg, there are 4 expenses that families pay, right? Premiums, deductibles, copays, and uncovered medical expenses. Mayor Buttigieg says he will put a cap only on the premiums. And that means families are going to pick up the rest of the cost. Amy, I looked online at your plan. It's 2 paragraphs. Families are suffering, and they need a plan. You can't simply stand here and trash an idea to give health care coverage to everyone without having a realistic plan of your own. And if you're not going to own up to the fact either that you don't have a plan or that your plan is going to leave people without health care coverage, full coverage, then you need to say so. I just want to say on this, when I was in Reno, when I met a man who said he had diabetes, he gets his insulin through the VA, but his sister and his daughter also have diabetes. No way to pay for their insulin. 3 human beings right here in Nevada
My plan takes care of that.
Struggling. They share one insulin prescription.
Mayor Bloomberg, was Vice President Biden right? You weren't a fan of Obamacare?
I am a fan of Obamacare. At the beginning,
Mr. Mayor.
Mr. Vice President, I just checked the record because you'd said one time that I was not. In 2009, I testified and gave a speech before the mayor's conference in Washington, advocating it and trying to get all the mayors to sign on. And I think at that time I wrote an article praising Obamacare. It was either in the New York Post or the Daily News. So the facts are I was there. Let me finish. Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.